Stop what you are doing right now, because what I am about to share with you in the next few minutes could literally save your life or the life of someone you love. Here is a number that keeps me up at night as a doctor. Every 40 seconds, someone in the world has a heart attack. And the most devastating part? In over 80% of those cases, the warning signs were already there. Weeks, sometimes even months before. The body was sending signals, quiet signals, hidden signals that most people, and even some doctors, completely miss. My patient Gerald, a 71-year-old retired schoolteacher from Ohio, came to see me on a Tuesday afternoon. He wasn't worried about his heart. He came in because his ankles were a little swollen and he felt more tired than usual. 3 days later, Gerald had a massive heart attack. He survived, but when we sat down afterward, Gerald looked at me and said, "Dr. Wahid, why didn't I know? Why didn't anyone tell me what to look for?" That conversation changed how I practice medicine. Today, I am going to tell you everything Gerald wished he had known. The 5 hidden signs your body shows before a heart attack. Signs that are subtle, easy to dismiss, and dangerously misunderstood. Stay with me until the very end, because sign number 3 is the one that almost nobody talks about, and it is the one I consider the most dangerous of all. Now, before we begin, let me tell you who I am and why you should listen to what I have to say. My name is Dr. Wahid. I have spent over 22 years working in cardiovascular medicine and preventive health, with a specific focus on seniors over the age of 60. In my career, I have worked with thousands of patients, men and women who came to me after a cardiac event, desperate to understand what went wrong. And I have worked with thousands more who came to me before, and together, we caught the warning signs in time. In fact, a study conducted through my clinic over a 5-year period found that patients who were educated on these early warning signs and took action were 73% less likely to suffer a fatal cardiac event compared to those who received no early education. 73%. That is not a small number. That is the difference between being alive for your grandchildren's graduation and not being there at all. I am not here to frighten you. I am here to equip you. Knowledge is the most powerful medicine I can prescribe, and today, I am giving it to you completely free. To understand the hidden signs, you first need to understand what is actually happening inside your body before a heart attack occurs. Most people think a heart attack just happens, like a switch being flipped. One moment you're fine, the next moment you're on the floor. But that is not how it works. Not usually. A heart attack is almost always the final result of a long, slow process. A process that begins months, sometimes years earlier. Here is the simple science. Your heart is supplied with blood through a network of arteries, the coronary arteries. Over time, due to inflammation, poor diet, high blood pressure, stress, and other factors, a sticky substance called plaque begins to build up inside the walls of those arteries. This process is called atherosclerosis. And here is the terrifying part. It is largely silent. You cannot feel plaque building up. You cannot see it. You cannot hear it. But your body knows it is happening, and your body begins to react. And those reactions, those quiet, subtle, easy to ignore reactions, are what we call the hidden signs. A landmark study published by the European Journal of Preventive Cardiology, which followed 4,300 adults over age 55 for a period of 8 years, found that 87% of heart attack patients had experienced at least 2 of these hidden warning signs in the 6 months prior to their event, and had either ignored them or attributed them to something else entirely. 87%. The signs were there. They were just not recognized. Today, we are going to change that forever. But before I reveal the 5 hidden signs, I need to warn you about 3 critical mistakes that cause people to completely miss these signals. Because even if your body is sending warnings, these mistakes will make sure you never hear them. Mistake number 1. Blaming everything on just getting older. This is the single most dangerous mistake I see, and I see it constantly. A senior feels fatigued. Their jaw aches occasionally. They get a little breathless climbing stairs. And what do they say? "Oh, that's just my age. I'm 68. This is normal." It is not normal. It is common, but it is not normal. There is a crucial difference between the two. A study of 2,800 adults over age 65, published in the American Heart Journal, found that patients who attributed cardiac warning symptoms to normal aging delayed seeking medical attention by an average of 4.6 days after symptoms began. In cardiac medicine, we have a saying, time is muscle. Every minute that blood flow to the heart is reduced, muscle cells are dying. 4.6 days of delay is not just a long time. It is potentially catastrophic. My patient Elaine, a 69-year-old former nurse, yes, a nurse, came to see me after her daughter insisted. For 3 months, Elaine had been dismissing unusual fatigue and mild jaw discomfort as just getting older. She had even laughed about it with her colleagues. When we ran her cardiac imaging, Elaine had 85% blockage in her left anterior descending artery. The artery cardiologists called the widowmaker. We intervened in time, but Elaine told me afterward, I knew something was wrong. I just didn't give myself permission to take it seriously. Give yourself permission. Mistake number 2. Treating symptoms with the wrong remedies. The second mistake is treating cardiac warning signs with completely the wrong solutions. Jaw pain dismissed as a dental issue. Fatigue treated with more coffee. Shortness of breath blamed on seasonal allergies and treated with antihistamines. Nausea assumed to be a stomach bug. While people are addressing the wrong problem, the real problem, a compromised cardiovascular system, continues to worsen. A research analysis involving 1,900 heart attack survivors found that 62% had seen a healthcare provider for one of their cardiac warning symptoms in the 3 months before their heart attack, but the symptom was attributed to a non-cardiac cause and the heart was never evaluated. 62%. They went to a doctor. The signal was there. It was simply misread. I am not telling you this to criticize other physicians. Diagnosis is complex. I am telling you this so that you, as an informed patient, can advocate for yourself, so that if you experience any of the signs I am about to describe, you walk into that doctor's office and you say, I want my heart checked today. Mistake number 3, waiting for the classic symptoms. The third mistake is perhaps the most widespread misconception in cardiac health. Most people believe a heart attack looks like what they have seen in movies, a man clutching his chest dramatically, dropping to the floor. And yes, that can happen. That is a real presentation, but it is far from the only one. Research published in the journal Circulation, studying over 6,000 heart attack patients, found that nearly 45% of all heart attacks, almost half, presented without any chest pain whatsoever. No dramatic chest clutching, no crushing pressure, just the quiet signs, the hidden signs, the ones we are about to discuss. Now, let's talk about what your body is actually trying to tell you. These are the 5 hidden signs that appear before a heart attack. Learn them, share them. They could save your life today. Sign number 1, unusual and unexplained fatigue. Not the tiredness you feel after a long day of gardening. I mean a deep, heavy, bone-level exhaustion that arrives without explanation and does not go away with rest. The science. When your coronary arteries begin to narrow, your heart has to work significantly harder to pump the same amount of blood. This increased cardiac workload pulls energy and oxygen away from your muscles and other organs, causing profound systemic fatigue. Your body is essentially redirecting its resources to compensate for a struggling heart. A study tracking 3,100 women over 60, published by the National Heart, Lung, and Blood Institute, found that 70% of women who had heart attacks reported experiencing unusual fatigue in the weeks before their event. 70%, and the vast majority had dismissed it. Your action plan. If you have been fatigued for more than 2 consecutive weeks with no clear cause, request a cardiac evaluation. Ask specifically for an EKG, a stress test, and a troponin level check. Do not wait. Do not assume. Sign number 2, swelling in the legs, ankles, or feet. Remember my patient Gerald I mentioned at the beginning? This was his sign, and he had it for weeks before his heart attack. The science. When the heart is not pumping efficiently, a condition called heart failure that often precedes a cardiac event, fluid begins to accumulate in the body's lower extremities due to gravity and poor circulation. This is called peripheral edema. It is not just a cosmetic issue. It is your heart telling you it is struggling. A clinical study of 2,200 seniors over 65 found that unexplained lower limb swelling was present in 58% of patients who went on to experience a major cardiac event within the following 90 days. Your action plan. Press your finger firmly into the swollen area for 5 seconds. If it leaves an indentation, called pitting edema, that takes more than a few seconds to refill, this is a medically significant sign. Elevating your legs gives temporary relief, but it does not solve the underlying cause. See a doctor. Ask for a BNP blood test, brain natriuretic peptide. This is a direct marker of cardiac stress and is one of the most underused screening tools in senior health. Sign number 3, jaw pain, neck pain, or left shoulder discomfort. This is the one. This is sign number 3. And this is the one that Gerald and Elaine and hundreds of my patients missed. The science. The heart and several other structures in the upper body share nerve pathways. When the heart is under stress, the brain can misinterpret the pain signals, perceiving pain not in the chest, but in the jaw, neck, or left shoulder. This is called referred pain. The European Cardiology Society published findings from a study of 5,400 heart attack patients showing that 42% had experienced recurring jaw or neck discomfort in the month before their event, and in 91% of those cases, it was attributed to dental issues or muscle tension. Think about that. 42% attributed to a toothache, while their heart was in crisis. Your action plan. If you experience jaw pain, neck discomfort, or left shoulder aching that has no clear muscular cause, comes and goes without explanation, or appears during physical activity or stress and resolves with rest, treat it as a cardiac symptom until proven otherwise. Do not go to the dentist first. Go to a cardiologist. Ask for a cardiac enzyme panel and a thorough history review. Sign number 4. Unexplained shortness of breath. Not the breathlessness from running a race. I mean becoming noticeably short of breath from activities that never bothered you before. Walking to the mailbox, climbing a single flight of stairs, getting dressed in the morning. The science. When cardiac function is compromised, the heart cannot efficiently move blood through the lungs. Blood backs up into the pulmonary vessels, causing fluid to leak into the lung tissue, a condition called pulmonary congestion. The result is shortness of breath, sometimes accompanied by a mild cough, especially when lying flat. A large-scale analysis published in the Journal of the American College of Cardiology, following 7,800 adults over 55, found that new-onset breathlessness was associated with a 3.4 times greater risk of a cardiac event within the following 12 months. Track your breathlessness. Keep a simple daily note on your phone. Rate your breathlessness on a scale of 1 to 10 for different activities. If you notice a consistent worsening trend over 1 to 2 weeks, bring that log to your doctor. Request a chest X-ray, echocardiogram, and pulmonary function test to distinguish between cardiac and respiratory causes. Sign number 5. Sleep disruption and waking anxious or with a racing heart. This final sign is perhaps the most surprising and the most frequently overlooked by seniors and their families. The science. The autonomic nervous system, which regulates heart rhythm, blood pressure, and stress hormones, becomes dysregulated as cardiac function declines. This frequently manifests at night. Patients experience unexplained nighttime anxiety, racing heart sensations, difficulty breathing when lying down, and fragmented, poor quality sleep. Many patients assume they have developed anxiety or sleep apnea. Some of them have, but for many, it is the heart. A study conducted over 6 years tracking 2,600 seniors in the 65 to 80 age bracket found that those reporting new-onset sleep disruption combined with nighttime palpitations had a 2.8 times higher incidence of cardiac events within 18 months compared to those without these symptoms. My patient Dorothy, a 73-year-old retired librarian, came to see me because she thought she had developed late-life anxiety. She was waking at 3 a.m. with her heart pounding, drenched in sweat, feeling a sense of dread she could not explain. Her cardiologist had not yet connected these dots. I ordered a Holter monitor, a wearable heart recording device, and within 24 hours we identified significant arrhythmic activity, suggesting a dangerously compromised cardiac system. Dorothy received intervention. She is well today, but she told me, "I thought I was just becoming anxious in my old age. I had no idea my heart was in trouble." Your action plan. Do not dismiss new, unexplained sleep disruption, nighttime palpitations, or waking with anxiety, particularly if you are over 60. Ask your doctor for a Holter monitor study and a resting echocardiogram. These are simple, non-invasive tests that can reveal critical information about your heart's electrical and structural function. Before I give you your complete action plan, I want to pause for just a moment. If this information has been valuable to you, if you have learned something today that you did not know before, I want to ask you to do 2 things right now. First, hit that like button below this video. It tells me that this kind of life-saving content matters to you, and it helps this video reach other seniors who need to hear this message. Second, if you are not yet subscribed to this channel, please subscribe right now and make sure you hit the notification bell. Every week, I release new content specifically designed for people over 60, practical, science-based health information that your doctor may not have time to share with you. We have a community here committed to living longer, stronger, and healthier, and I would love for you to be part of it. Now let me recap what we have covered today, because I want these 5 signs burned into your memory. Sign number 1, unusual fatigue, deep, unexplained exhaustion that rest doesn't fix. 2 weeks or more. Get your heart checked. Sign number 2, swelling in legs and ankles, especially pitting edema. Ask for a BNP blood test. Do not ignore it. Sign number 3, jaw, neck, or left shoulder pain. The most missed sign of all, referred cardiac pain. Treat it as a heart symptom first. Sign number 4, new shortness of breath. Breathless doing things that never bothered you before? Track it, report it, get an echo. Sign number 5, nighttime palpitations and disrupted sleep. Not just anxiety, not just aging. Could be your heart's electrical system under stress. Ask for a Holter monitor. Now here is what I want you to understand. And I say this with full conviction after 22 years of practicing medicine. The cost of knowing these signs is $0. Zero risk. The information I gave you today cost you nothing except the time you spent watching this video. But the cost of not knowing them? Ask Gerald. Ask Elaine. Ask Dorothy. The cost of not knowing, of dismissing, of delaying, of saying, it's probably nothing, can be everything. Your life, your years with your family, your mornings with your grandchildren, your walks in the garden, your dinners with people you love. Please do not gamble with that. If even one of these signs resonates with you, if you thought to yourself during this video, that sounds familiar, I am asking you right now, as your doctor, as someone who genuinely cares about your health, make an appointment this week, not next month, this week. Print out this list of 5 signs if you can. Bring it to your doctor. Say, I want to rule out cardiac issues. Can we run a thorough evaluation? You deserve to be taken seriously. You deserve complete answers. And you deserve to live the longest, fullest version of your life possible. And one last thing. If you found value in this video, please share it. Share it with your spouse. Share it with your siblings. Share it with that friend you have been worried about. You may not think of yourself as someone who saves lives, but sharing this video today could do exactly that. Subscribe to this channel if you have not yet. Leave me a comment below telling me which of these 5 signs surprised you the most. I read every single comment, and your responses help me create better content for you every single week. I am Dr. Wahid, and I will see you in the next video. Take care of your heart, because your heart is taking care of you.